Hello, everyone. Welcome to another review for our students. We are still on hypertension, management and prevention, part 5. Let's welcome Ma'am Trix Guevara of Sampaloc, Manila. Okay, based on this
Hello.
foundation, what do you think is the cause? So here you will have on bold letters, hypertension, aggravated by movement. Um, So you will be looking at something that's deficient, diba?
Mm.
So
Um,
sallow complexion, blurry vision, loose stool. So tongue is pale dry, pulse thin, choppy, slightly wiry, particularly in the liver position. What do you think is the pattern?
Spleen and liver blood deficiency.
Mm, what about chi deficiency? So it should be
Spleen
yeah, kasi you have here shortness of breath, diba? SOB. Hmm?
so
It's very see there's also um so this is actually general, no? Thin, choppy. Okay, this one is very, very descriptive, choppy, slightly wiry, no? So very yeah, pale and dry. So we will do away with yang deficiency.
Yeah.
So brittle nails, dry hair, and skin. Okay, so muscle weakness. So the answer is chi and blood deficiency.
Mm.
The important points here would be something to tonify the liver. You were correct, no? Liver blood deficiency. I think you answered. You were very specific. Okay, so that's good because of the blurry vision, diba? Loose stools. You were also looking at spleen chi deficiency, right? So
Yeah.
medyo redundant na rin kasi spleen and liver, and we all know that they both have something to do with blood, no? So abi with chi, right? And also blood. Of course, if there's chi deficiency, there will be blood deficiency. So the tongue is pale and dry, and the pulse is thin, so that's very blood deficient, choppy. Okay, so slightly wiry. So liver 8, you can use do 20, which is one of the general points for hypertension, and stomach 36 to
For
for
the
blood, for tonifying the chi and blood, diba? Next, what is the cause of the hypertension here? So very, very easy. Flaccid cheeks, hot palms, and soles. So I think this is so classic, no? However, if you take a look, meron din siyang pitting edema, no? Pitting edema, low sex drive, aversion to cold, no? Okay, so when you look at the tongue, it's red, yin deficient, and pale, yang deficient. So it's both red and pale. Okay, actually ganito yan. If you have a more predominant, there are actually two patterns here, no? Obvious naman. So if the tongue is pale, so there will be predominance of yang deficiency, but if the tongue is red, predominance of yin deficiency. Pulse is steady, wiry, and so if it's rapid, so it's definitely yin deficiency. So what is your answer?
liver yin deficiency with empty heat and kidney yang deficiency.
Or yin and yang deficiency? Napaka-specific mo, ha? So the important points would be Ren 4, favorite, no? Um, do 20 again, very generic. Spleen 6 for the spleen, liver, kidney, yin. Diba? Do 4 to for the young, what's this? The Mingmen fire, right? Mingmen fire. What are the foods to avoid with hypertension?
Foods to avoid high in salt, added sugars,
Mhm.
saturated fats, and processed foods.
What about sweets?
Sweet. Yes, added sugars.
Sweets kasi can cause phlegm, no? So that can
Yes.
actually impair circulation, carbs,
Alright.
alcohol, and caffeine.
Alcohol.
No? So, ang daming sakripisyo.
Yeah.
Pag nag-normal, inom ulit. Okay. Number Let's go now to the key symptoms of spleen and kidney yang deficiency. Spleen and kidney yang deficiency, they almost always go together, no? So this time, para fair naman, let us give you the answer already. So the hypertension would be definitely, kasi deficient, no? Uh,
Mm-hmm.
back pain,
Go back for kidney.
cold with
Kidney.
sensation of cold. This is yang deficiency. Feel
Mm-hmm.
cold and weak in the legs. Then the complexion is bright white, no? Impotence, decreased libido, tiredness, lassitude, abundant clear urination, urination at night, edema of the legs, infertility in women. Okay, so loose stools would be spleen yang deficiency, depression, poor appetite, slight abdominal distension, desire to lie down, early morning diarrhea, no? Chronic diarrhea, tongue pale swollen with teeth marks, wet, moist coat. So the moist or wet coat here is very young deficiency. Okay. So pulse is deep, weak, slow. What about phlegm obstructing the orifice and blood vessels? So the diastolic
High
blood
pressure.
pressure is high. No? So people mataas yung diastolic, you would be looking at phlegm that is obstructing the circulation. Dizziness, fastness, heaviness of the head. This is very pathognomonic of phlegm, high cholesterol, oppressive feeling in the chest, blurring of vision, tinnitus, nausea, feeling heavy. That is why meron na tayong bagong, yeah, somebody from Cebu is, I think I sent you, no, phototherapy. Hindi siya lazy.
Mm-mm. Yes.
A little bit exciting. I was actually asked to explain it, no? Kasi yun na talaga yung trend. Swollen. So I guess sabi nga doon, it doesn't work on all. So you need to really identify the pattern, no? Very carefully.
Mm-hmm.
So swollen with sticky coat, no? Pag swollen kasi yung tongue, that's very, very phlegm. Slippery and
Mm-hmm.
now, what about for liver fire? So dito, liver fire, parang apoy din, high systolic as contrasted to ano, yung isa high dystolic, diastolic. Irritability, outbursts of anger, tinnitus. Tinnitus here would definitely be high-pitched, no? Deafness, temporal headache, bitter taste, no? Dream disturbed sleep, constipation with dry stool. So pagbasa, it's another story, no? Dark yellow urine, epistaxis, hematemesis, hemoptysis. The tongue would be red, whether on the sides, such as very liver fire, dry yellow coat, forceful, wiry, and rapid. Pag liver yang rising, here you would have headache that may be on the temples, on the eyes, or the lateral side of the head. So this one, I think, is a precedent of liver fire, no? Bago siya mag-liver fire. Tinnitus, deafness, high systolic BP also. So that's very liver, blurred vision, dry mouth and throat, irritability, feeling work up, outbursts of anger, stiff neck, tongue red with yellow coat, then wiry, thready, rapid. So what is the treatment principle if you have liver young rising hypertension?
We nourish the liver and kidney and then subdue the liver yang.
Yeah, actually, kaya nag-liver young rising yung mga medyo maedad na, no, like me. Dahil sa kidney essence, no, nag-diminish na rin. Siguro this is the result of hard work when we were younger. So now,
Yes.
payback time. And isabdo na lang yung liver young. Yon. So you don't only nourish, you have to also subdue it, no? Actually, I think una-una mong gagawin is to subdue the liver young.
Liver yang.
What about liver fire hypertension? Of course, this is too obvious. You
We
do
drain.
drainage, yes. And then what are, okay, ito naman, I think what we took up today are the most common patterns that we see, no? So,
Mm-mm.
liver yang rising, napaka-common yan. So, these are the points. Um,
Liver.
you take a,
Liver 3.
yeah,
Yeah.
when you see minus, yan yung sinisedate natin,
Yeah.
no? Whereas,
Mm.
yung plus, you take
Unified.
25. Okay, so I think everybody knows this. And then for liver fire hypertension, sabi mo nga kanina, we have to drain the liver fire. Right? So, di nilagyan ng minus kasi minus lahat. You don't moxa at all. Kasi my
Mm.
God, it's so obvious, no? Liver fire.
Fire.
You don't moxa. Next. And by the way, GB21 is contraindicated on pregnant women. So be careful.
Mm-mm.
And I was actually looking at the possibility of, I've seen kasi gua siya, ano, this is very good for the community, no? May mga pointed na gua siya. I actually just acquired, I bought several shapes online. Mura lang.
Yeah,
Maganda. Also for the face, ganun. Okay, then for phlegm. Diba pag phlegm obstructing the orifices and blood vessels, you would be looking at high diastolic, no? Usually above 100 yung diastolic. So the
yeah.
acupuncture treatment would be, um,
C6.
yeah,
C5 and 9. Ah,
right.
yeah. Stomach 40 kasi first
Mga
phlegm.
40 talaga yung star dito, no?
Phlegm. Yeah.
Reinforce, to tonify. So ito lahat, pwede mong i-even except bladder 20 and REN 12. Kailangan mo siya talaga i-tonify. Bladder 20, di ba? Back shoe of the spleen. REN 12, front move, no? Okay, for spleen kidney yang deficiency hypertension, we also tonify all, combine it with moxa, obviously, because of the yang deficiency. Okay, so I think this is all generic, no? Kidney 7, we tonify the yang, bladder 52. Um, 22. Yeah. Kasi bladder 52 is 1.5 soon from bladder 23, di ba? This is the outer back shoe. Minsan kasi pag masyadong matakutin yung pasyente or masyado ng overstress,
Mm-mm.
no, I'm sure you're familiar with the outer back shoe, no? I think that's, the gua sha there could help. Ito yung parang yung
Mm-mm.
point sa likod. Okay. Ren 9, stomach 37, 25, bladder 25. And then for the phlegm, what is your treatment principle?
We resolve phlegm. Open the orifices of the head.
Yes, of course. And finally, um, for spleen kidney yang deficiency hypertension, very easy.
We tonify.
So we do more. Yeah. So you should know the points. Thank you so much, everyone. So I think that's about it.
Thanks.
Basically, these are the patterns that you usually